Hi there, I'm a Psych NP and I have 10 test-taking strategies to get you through NP school. Ready? Let's learn Psych fast. Point 1. Read all the answer choices. Remember that partially correct answers are not the correct answers. You want to narrow it down to 2 possible right answers. So how do you do that? Look out for similar words like synonyms in the question compared to the answer. When 2 answer choices are the opposite of one another, one is usually the correct answer. Always remind yourself of what the examiner is asking you. Like if one says hypernatremia and the other one says hyponatremia, or like hypertension versus hypotension, one of those is usually the correct answer. And then the right option might have the same word or words as the test question. It can be the same word or synonym of the word. When in doubt, choose patient-focused answers, not the answer where you're confronting that patient or client. When many response choices are remarkably similar, they usually are wrong. For example, if there's 3 SSRIs but only 1 SNRI, or 3 assessments and 1 medication, it's usually that one. Look for answer choices containing absolutes like all, only, always, every, must, never, none, everything, nothing, those kind of things. Those are usually wrong. Then sometimes the longer answer is the correct one as it's more specific, thus complete than the other options. Point 2. Do not read into the question. Only use the information provided by the examiner to answer the question without making any assumptions or adding more information into the question. This will prevent you from adding more to questions that was not in it. Tip 3. Read the entire question carefully before answering and identify what the question is actually seeking. Do not skim over the words or read them too quickly. When reading the question, pay attention to keywords. If it's a long question with many sentences, pay attention to just the last sentence as it may actually have what they're asking of you. Tip 4. Questions that use adjectives like priority, initial action, test your ability to prioritize. This goes back to nursing. Remember? Airway, breathing, and circulation, your ABCs. So Maslow's hierarchy of needs, the physiological needs like food, water, warmth, rest, safety, and security. Know that. Also know the nursing process. Remember that? Assessment should always come before interpretation like labs, vitals, literature review. Assessment is collecting data to support the problem towards a resolution. You want to know the difference between assessment versus intervention answers. Tip 5. Safety for the patient and others is usually the right answer. Reassure them that they are in a safe environment, especially if in an abuse patient. If patients bring children in that was, say, abused, you do not want to interview the child with parents in the room as they might not want to state it is the parent or the uncle doing it. You can be concerned the child patient is being abused based on how they're playing with toys. You immediately want to report it to DCFS. Prior to discharging patients, make sure that they have coping skills and does not have any thoughts of self-harm. When interviewing teenagers, you must develop therapeutic rapport that will let them know that the information they provide will stay confidential. Thus, do not interview when parents are in the room as well. A child does have the right to confidentiality, and parents, they do not have the right to know. There's no need to tell parents if their teenager states they're attracted to the same sex unless that person is an adult. Do not interview patients in a day room or their room. It should be in a private office with the door slightly open or fully open when inpatient so you can quickly get out in case the patient becomes aggressive. Tip number 6, culture is important to be included in all nursing care. When they specify ethnicity or country they are from, if a culturally expected response to a stressor does not mean that they have a mental issue. ask patients to interpret what the symptoms mean in their culture. So you need to validate their symptoms, obtain context, as this might just be a cultural syndrome and they do not actually have a mental disorder. They might just need brief supportive therapy. You also want to respect what their interpretation consists of for their interpretation of their behavior. For example, some natives may say that mental health illness is due to an imbalance between an individual's relationship with the world. Native Americans may believe in the healing stick, which has healing powers. So if you're an inpatient provider of a Native American and another staff member is trying to take the stick as they thought it was a weapon, you need to teach that staff member cultural sensitivity as you understand the significance of the healing stick. You want to make accommodations. These are the ethnic groups in the U.S. with the highest suicidal attempts and rates. So integrating their cultural beliefs in their plan of care, as long as you can obtain clearance for informed consent to bring the third party in like their traditional healer, if that's something they want. If you're dealing with a specific community, you need to know culture so that you can provide multicultural education and use ethno-specific assessment parameters. If a patient cannot understand English, you need to provide an interpreter, and they also have to be culturally sensitive. Tip 7. If you're undecided or you think there is more than one correct answer, the umbrella is usually the right answer for non-priority questions. The umbrella answer encompasses the other answers, aka it's a comprehensive answer. Tip 8. Interprofessional collaboration is encouraged. Choose answers where you are actively involved rather than asking someone else to do something. If in an office and you're doing initial intake and the patient passes out, you give ED report and request if the ED doctor can complete their intake evaluation, as the patient might not come back and their mental health is important. Tip 9. Use the paper or the whiteboard that's given to you at the testing site and practice beforehand writing it out so that you can do it in a timely fashion. Also, use those flags to mark questions you want to go back to. Tip 10. Remember, self-care is not selfish. Prioritize your time. Take regular breaks. Go out, get fresh air. Eat good, whole foods rather than processed food, and get more sleep. Well, I hope these 10 tips help you for your test and even for your final exam and even for your national boards. Good luck. Oh, please share this with a classmate if you found this to be helpful, and don't forget to subscribe. Thank you.